And we're back here in Africa. In Malawi, the health ministry says the number of deaths from cholera has risen to about 103 from 110 at the beginning of October. In a statement, the ministry says the rate of infections has been rising, with a cumulative number of cases since the outbreak began in March, now 6,056. Cholera is an acute diarrhea infection usually caused by eating or drinking contaminated food or water, and is closely linked to poor sanitation. Malawi's health ministry attributed the deaths to poor food hygiene among the communities, lack of safe water, and a lack of improper use of toilets. Now, for more on the situation in Malawi and Africa's disturbing disease burden, I am now being joined from Abuja by consultant family physician, Dr. Agbo Ebuta. Good to have you join us, Dr. Ebuta.
Good afternoon. Thanks for having me. Welcome, Nigerians.
So just beyond Malawi, Nigeria also experienced a cholera outbreak, and we seem to be seeing a surge in cholera outbreaks around the world. Why is that?
Well, part of the reason is that there continues to be cholera endemicity in most of these disadvantaged countries, low and middle income countries, and like most of African countries where public sanitation is at its lowest. For example, open defecation is at its highest in anywhere in the world is in Africa. And open defecation means that there's indiscriminate deposit of fecal matter. And cholera is found in fecal matter. And in fact, suffice you to say that anybody who has cholera has eaten food or drank water that is contaminated with feces. So to a large extent, it has to do with a complete breakdown or partial or complete breakdown of social welfare intervention that guarantee optimal disposal of feces and access to clean, safe, and hygienic water, apart from other social support practices like hand washing, hygiene, and all of that.
And unlike the coronavirus, there is nothing novel about cholera. We've had to deal with cholera over and over again. But why do we still have significant gaps in terms of the response to the outbreak?
We have significant gaps because we are underdeveloped society, and our indices and our interventions remain archaic, and to a large extent, governance has failed to respond adequately. In responding more in-depthly and comprehensively to why Africa continues to fail is because we could use the health system approach where we look at the finance model. What's the finance model in Africa? Most African countries, payment for health services is still out of pocket. In Nigeria, that payment for health services is what? 70% or thereabout. Means 70% of Nigerian patients will pay from their pocket. And this is unacceptable. You need to have national health insurance programs across the continent that has strengthened. In the case of Nigeria, the recent act, the National Health Insurance Authority Act, that was signed this year by the president, to a large extent, if it is deployed adequately, will address some of these problems. In Nigeria, we have 30,000 primary healthcare centers on paper, but only 20% of that are functional. So we probably have 6,000 to 10,000 primary health centers that are functional. So we need to be able to activate these 30,000 primary healthcare centers so that primary healthcare, which is where most patients with cholera will present, is activated. Apart from the financing model, which we need to strengthen, we also need to look at human resource. At a time when the human resource global market is experiencing a lot of competition and challenges with supply, with immigrations of health workers from countries in third world countries to Western countries, like we've seen in Nigeria, a drop of doctor supply from about 35,000 to 24,000 in recent quotes. It is definite that we need to look at strategies to increase the number of human resource availability. It means that we need to train more people. That is only that's another sustainable measure that is fit.
I want to take you from there. Because you're raising, yes, in terms of training more people, and I don't think it's just Nigeria alone. I don't have the data, But I think that we're losing a lot of doctors who are leaving the country.
Nigeria, Ghana, Kenya,
Absolutely.
Uganda, they are all leaving.
And this
Yes.
is a continent, Dr. Ebuta, that is recovering from. I'm not sure we've recovered, or even if our health sector has recovered from the COVID-19 virus. But now we're dealing with monkeypox. We're dealing with Lassa fever,
yes,
and then Ebola virus as well.
Absolutely.
How bad is this for us as a continent?
I think it's really, really serious, and it's really, really bad. I mean, it will get to a situation. The doctor-patient ratio continues to increase astronomically. I mean, I'm personally worried that if I don't feel too fine, who is going to attend to me? I mean, Abuja, the ratio here is very high, but if you go to some states in Nigeria, that ratio is even unacceptably much higher. So we need to strengthen human resource capacity. We need to start stemming the tide of my immigration, and then we need to start building quickly. Every state has to be able to increase the number of supply they make to the central pool, community health extension workers, nurses, pharmacists, and doctors using clear strategy. Apart from that, for the doctors and the other health workers who are available, we need to train them and retrain them. We need to deploy social media technology to increase their capacity for response, identification of patients who have cholera. We also need to strengthen our health information system. Our health information system is structured in a very archaic way so that data collection remains a very difficult thing. But with technology, social media, and all of that, we should be able to build a robust electronic medical record system that will allow easy collection of health data so that we can identify epidemic spikes in epidemics, progress to pandemics early enough, and escalate this through the proper reporting channel, which is through the disease notification officer in the health center, in the local government, to the state, to the federal ministry, and then to the WHO for international intervention as necessary. But more specifically for cholera, every patient that has cholera is likely, or symptomatic cholera is likely, to lose fluids in significant quantities. So we need to ensure that there's a logistic arrangement, efficient logistic arrangement that deploys simple technology like oral rehydration solutions, IV fluids, and antibiotics to every nook and cranny in Nigeria as at when needed, because any delay in the supply of this simple technology means that people will die. In addition to that, we also need to set up what we call clear leadership and governance in healthcare sector, which ensures that community engagement, multi-sectoral intervention, like resources, Outbreak, and everybody is on. So there needs to be a significant education.
I'm afraid I have to jump in because of time. Thank you so much for your thought on these issues, and I'm sure we'll continue to have this conversation with you as these cases progress. Consultant family physician, Dr. Outbreak, thank you.
Thank you.